Everything you need to know about laser hair removal, no matter what skin type you have. Hello everyone, welcome back to another video with me. My name is Deanna and I'm your Esty with the bestie. We're going to be talking about the consultation, the pre and post care, the what to expect in the treatment room, the type of machine or laser we have in our clinic, and how it all works. Any consultation, just like any other treatment, because this one is a little more invasive, you want to make sure you have the proper consultation. And in a proper laser consultation, this is a little bit more thorough, so they should have asked you on your consultation form your medical history, any medications you've been taking, any vitamins, all your skincare routine, any exposure to the sun, any medications that can be photosensitizing, if you have diabetes, if you're on cold therapy, if you have a history of cold sores. All of these things factor into laser hair removal and if it is safe for you. These are all protocols and it should be asked prior to you getting laser. And majority of the time, most lasers are pretty safe nowadays for all skin types. However, we are going to discuss the different options there are and specifically what we have in our clinic. So let's move on to pre and post pre-care treatment, and this should always be asked when you're in your consultation as well. And prior to the consultation, you should be sent a pre-care treatment plan leading up to your laser treatment appointment. So what we need from you is to make sure you are not exposed to the sun, you have not been actively tanning. Prior to the appointment, just shave the area because we want to make sure it is clean and we are only targeting the bulbs of the hair. And pretty much that is simple. No active ingredients on the area, which is just like any other treatment, but because laser is a little bit more photosensitizing than any other treatment, we always suggest that no active ingredients or anything that can get your skin a little more photosensitized. If you are on Accutane, we want to make sure that you stop this within 9 months of leading to your appointment, and this is because Accutane is a strong type of antibacterial clearing treatment that your doctor gives you. So I'm not really 100% sure what exactly Accutane is, but I do know that it helps clear your body from the inside out, so it's very dehydrating. And when it comes to laser, you want to make sure you are hydrated, so making sure you moisturize almost every day leading up to your appointment and staying hydrated. Before we talk about post-care, let's talk about what to expect in the treatment room when getting the procedure or treatment done. It's going to be a little bit spicy, like elastic band snappy feeling when you are getting it done because it targets the hair follicles and the pigment, and that's going to just give you that elastic band snap. Could be a bit more spicier. Some people it could not be tolerable, some people you can. Depending on what laser you have, you can definitely adjust the levels so the energy is not as high, so then it's not as snappy. We do apply a cooling gel over your skin and the area that we are treating, so it's nice and cool, but otherwise you can still feel a little snappy feeling. That spicy, snappy feeling does go away once there's less and less hair, so the more treatments you do, the less snappy it is because there's less pigmentation to target. There's an attachment, and it's a cooling attachment where it's releasing real cool air, so then the surface is quite cool, and basically we just run along the lines of where we're working and just making a pattern as to what we're working on. So there are different spot sizes, meaning there's like the smallest I believe is 2mm spot size to the largest I think we have is 24mm, which is the largest spot size. So sometimes when we're doing a full body hair removal, it can take about 2 hours because we are working with such a small spot size anyway. So we do go over by 10% usually with the hair removal, but we try to not go over the same spot in the same treatment, because it can be too much energy and we are not trying to do any damage to the skin. Essentially, after you finish your treatment, you are going to get a post-care treatment care, and what the technician should be doing is wiping off your skin and making sure everything is intact and cool. And we would put aloe gel on it and sunscreen, making sure you protect your skin from the sun at this point, because it's very sensitive. It can have a little bit of parafollicular edema, which is little swelling and redness around your follicle, which is completely normal because the laser is targeting those bulbs of follicles in your skin. So it's essentially what it is, it's damaging the follicle so then it won't regrow in the future. Of course, taking into factor your hormones, any medical histories that kind of play an important role with your hair growth on your body. So all of those things are taken into factor, and each journey is of its own. So every individual has their own journey. You can't compare yourself to other people because your hormones are all different. Your DNA is all different from everybody else, and it's to its own and unique to its own. And for the next 7 days, you want to stay out of the sun as much as possible during that time, at least the area that you are being treated for. Stay out of the sun, making sure you're really good with sunscreen. SPF 30 is always recommended, and the reason being is because it can hyperpigmentate if you do not use proper sunscreen and aftercare. Making sure you don't use any active ingredients on the area as well, because it can be very spicy. Otherwise, just keep on hyaluronic acid, moisturizer, and sunscreen always. So basically, we're treating it like a damaged skin barrier because it's so sensitizing, and the ingredients and products you need to focus on using is something that is like ceramide, shea butter, aloe vera, green tea extract. All of those are all soothing and healing properties. They're the ones we want to focus on and make sure we lock in moisture, so then it is going to be nice and cool. The machine that we use in our clinic is called the Cynosure Elite Plus. I don't have it at this location, so that is why I am showing you this. So it's right here. This is one of the gold standard laser hair removal machines there is on the market. It has both the NDA, which is the 1064 nanometer wavelength, and the Alexandrite, which is the 755 nanometer wavelength. And the difference between the both is that this Alexandrite targets more pigmentation, and the NDA targets more hemoglobin, or the water in our skin, and that is how it's going to target for all skin types. So the Alexandrite is really recommended for people with Fitzpatrick's 1 to 3 versus the NDA is for 1 and everything. And we still want to be careful because both of them can be very powerful. We want to make sure we use the proper wavelength and settings for each client. So making sure doing the proper consult and getting their Fitzpatrick type is so important. And this is included in the consultation as well. Sorry, I forgot to mention that in there. But knowing your skin type and ethnicity can really help us basically set the setting at a proper setting and safe setting to do a proper laser hair removal on you, and making sure that you are quite comfortable. Because if we do not set it at the proper setting, you could be burnt, and we don't want that. Some people get second-degree burns, third-degree burns, and it's just not pretty, and it can leave a scar, especially if you guys are more higher Fitzpatrick, like 4 and higher, 4 to 7 we'll say. You can hypopigmentate, and it's so much harder to cure someone who has hypopigmentation than hyperpigmentation. So gotta be very careful with the higher Fitzpatrick types. Let's talk about how laser hair removal really works. Before we begin with that, we need to understand the hair growth cycle. There's 4 different stages in the hair growth cycle: the anagen, the catagen, telogen, and exogen. And the anagen is the growth phase, The catagen is the transition phase, transitioning to the telogen phase, which is the resting stage. And then the fourth one is the exogen, which is the exiting phase, where our hairs are shedding from our body in the winter and the summer, and that's essentially how it works. And so with laser, it only targets the anagen phase. So how does that really work? And how do we know? Our body's hair is only 10% of it in the anagen phase, and this is why it's so crucial to know that it's not a one and done treatment. It is a consistency of coming back, and typical, most general people who are healthy and don't have any issues is usually within the 7 to 10 treatment stage. Some people there could be more, some people there could be less. Really depends on each individual and their hormones, their body type, their DNA, and whatever else in their history that can cause fluctuation in their hair growth. It is a permanent reduction of hair removal. So just understand we may need some maintenance in the future because some women get pregnant, some men are just hairier than others. Depending on hormones, you may just get that hair growth back. So understanding your body, getting the proper blood work, understanding if you have any hormonal issues or health issues, that can all play into factor of how laser hair removal really works on you. That is all the information I have for you guys with laser hair removal from what I've learned and what I'm still learning. I'm constantly modernizing and learning still in the industry, but I hope this was very educational and knowledgeable, and all the tips and tricks and what to expect in the clinic room, so you guys can make the right decision for you if you guys want to do laser hair removal or want to know what to expect in the treatment room. If you guys do like this video, give it a thumbs up, comment below what you want to watch next, or if you have any questions, I will do my best to answer them. Otherwise, thank you so much for watching. Please subscribe to my channel so you don't miss another tips, tricks experience with me, your Esty Bestie. I'll see you guys in the next video. Bye.